I want to share this with you because I learned this many years ago. It's a very simple restorative technique using resin modified glass ionomer. And let's go ahead and watch what's going to happen here. So this patient actually, if you can imagine, didn't need to be numb for this. And there was an old amalgam restoration that was placed here and it decayed. There was decay, returned decay, and then we needed to just replace it. So rather than place an amalgam, which is a great restoration, but you need retention, and a lot of the restorations we place today are either composite or resin modified glass ionomer. So I choose to place resin modified glass ionomer, and that's what I want to show you today. Such a simple technique. And so we remove the decay, and I'm just going to remove a couple spots of decay with this slow speed. We're just doing a slow round burr. And this technique actually is really interesting because there's a couple ways you can do it. I was taught by a young dentist several years ago how to place resin modified glass ionomer and then reduce it using, if you can believe this, a high speed white stone. I had no idea you could do that. And then when I was working in Europe for several years, actually a German dentist showed me that you can use, if you take the cold spray like endo ice and place it onto an instrument. If you're going to like a plastic instrument, you spray the cold onto the plastic instrument, you can actually move the resin modified glass ionomer around without it sticking to your instrument. Now I used to do that technique, and then I watched, then I was shown the essentially blob the restoration on and then cure it technique, and then use a white stone, and it made life so much better. So here I'm just placing some cavity conditioner. We'll let that take effect, and then we'll rinse it off. Now, I posted this as a short a few years ago, same technique, and a lot of the questions I had were, would you place just regular composite? And certainly, I was even talking to another colleague who's completed the same residency as me, and this gentleman uses composite for buccal restorations as well. So, I mean, certainly I think it depends on the patient, it depends on the situation, it depends on the location in the mouth, and it really depends on what you're trying to achieve. With these types of posterior restorations on patients, I find typically resin modified glass ionomer works well, and that's what I choose to do. But you can, and we used to place amalgam here before we had all these things. So here we go, and we're just using a white stone at 200,000 RPM. And this stone, the shape, it's been used before, and the shape is a little bulbous. So the beauty is, if you can compare the difference between now and before, what I did was I took a diamond, a straight diamond, and I just shaped it with the high speed. If you want, put it in the comments below if you want to see how you do that. It's really simple, and it gives me a little bit of a better point, and then I'm not invading onto the gingiva, because remember, this patient's not numb at all. So all I'm doing is I'm literally keeping the white stone on enamel. And actually what I love about using the white stone is that it essentially polishes the enamel. It's such a fine grit, it's not really removing any tooth structure. And so I'm keeping it on tooth structure, and then even for the gingival portion here, I'm keeping it on tooth structure, and then running it, lots of water, and that is it. It is so much easier than trying to fiddle with this material when you're just trying to move it around with an instrument. Now you definitely, because we're getting near the gingiva, the gingiva is going to hemorrhage a little bit. That's completely normal. And that's it. The restoration is essentially complete. So one thing I did show in the last video that I did is that I placed fluoride varnish, and there is a protective layer that you can place. You can place bonding agent, you can place a clear coat, I can't remember what it's called, and we just place Dorflor on these restorations. And the idea is that just for the first 24 hours of setting, it doesn't imbibe water, so it doesn't absorb water. So that's the idea. So thank you so much for joining me. Actually, this video is going to end, but I'm actually going to include, not voiced over, but it's the first, and I'm curious to kind of hear your comments about the next patient you're going to see And really what it is this has been a mode of treatment that I've been using for cracked teeth. And rather than stripping the tree of its bark in an effort to save it, I'm not really an enamel stripper, I guess. Is there such a thing, stripping enamel? But what I will do is so this patient complained of essentially cracked tooth syndrome. I'm not going to get in the weeds of that. No lingering pain, just kind of biting down on one of the cusps, and it was painful. So in the first, rather than placing crowns, and this tooth, still do the same restoration. I have restorations like this in my own mouth. You're going to watch a direct composite restoration. Certainly you can place an indirect restoration, place a crown, place an onlay, all of these things. But in an effort to preserve as much tooth structure and have it repairable, or essentially use this as a diagnosis if you want. There's so many different ways you can approach this. But what I do is I essentially it's a direct composite onlay, and that's what we're doing. So I'm just going to let the music go, and if you have any questions, let me know kind of the questions you have. The preparation is a little bit different, so you may actually have some questions about that. Every situation is a little bit different, but this is what I've been doing for many years, and actually this is a technique I've been doing on molar endo. Of course I do mostly endo, and this is the way to restore most of the teeth. And really the idea is to minimize the amount of destruction of tooth structure and preservation, but also in an effort to prevent flexing of the tooth and eventual breakage. I'm going to stop talking and we'll let this run, and let me know what you think. Hey, Ash here, and I wanted to take a second of your time just to introduce our course, Root Canal Like an Endodontist. We've had it for a couple years, and we've had some amazing successes through it. Just confidence building on behalf of our students. And really, what happened was a few years ago, I wanted to create a course to help others because I know what it's like on your endo journey. A lot of times, you don't know what's going on. You don't know if you've ledged it. You don't know what to do if you blocked it. You don't even know if a curved canal, what to do. And what I wanted to do was take all my mistakes and my training from my residency and put it into a affordable online course for everyone around the world to join in. And it's been absolutely amazing. And I wanted to offer to you, check us out at allthingsendo.ca. Once you join the course, you get access into our private Facebook group where all of us answer questions. And I'm telling you, there are questions every day that you might be able to, I'm sure you'll be able to connect with, because sometimes it just takes a little bit of courage to ask a question and then your outcome may be incredible. Anyways, I look forward to seeing you there. allthingsendo.ca. We'll talk to you soon.